Okay, good evening, everyone. Thank you for taking the time to attend our webinar tonight about the ketogenic diet for epilepsy. My name is Rena Laughlin, and I am the Program Director for the Epilepsy Foundation Eastern PA. It is my pleasure to be your host this evening to tonight's webinar, brought to you by a wonderful collaboration between the EFEPA, it'syourepilepsy.com, the Brain Recovery Project, and the Chelsea Hutchison Foundation. Tonight, we have two great speakers, both named Sarah, who will provide us information about the ketogenic diet for epilepsy. Sarah Brooks is a metabolic and ketogenic dietitian at the Children's Hospital of Philadelphia, where she has worked for the last 6 years. In addition to her experience as a metabolic ketogenic RD, she has worked in bariatrics and long-term care. In 2017, Sarah received her board certification as a specialist in pediatric nutrition. In her spare time, Sarah likes to spend time with her husband and her son, Henry. They enjoy traveling, hiking, and cooking. And we also have Sarah Tefft, and she has worked at the Children's Hospital of Philadelphia in outpatient neurology for the past 7 years and has been a nurse practitioner there for the past year. Her professional interests include the use of the ketogenic diet for epilepsy, as well as quality improvement for children and their families with epilepsy. Sarah is a member of the EFEPA Professional Advisory Board. She's also an active volunteer with the foundation and looks forward to attending Camp Achieve every year, which is a camp for kids with epilepsy. So ladies, the floor is yours.
Thanks, Rena. And I also wanted to give a special shout out to EFEPA for celebrating their 50th anniversary today. Next slide. So learning objectives, things we're going to talk about today. So we'll learn about what the ketogenic diet is as it's used as a treatment modality for epilepsy. We will dispel some common myths associated with the ketogenic diet. We will review the difference between the ketogenic diet used for weight loss that's popular now and how it is used as management for epilepsy. Next. So epilepsy, so these numbers are probably very familiar to a lot of people. So 1 in 26 people will be diagnosed with epilepsy at some point in their life. 1.2% of Americans, or 3.4 million people, have active epilepsy. And 65 million people around the world are living with epilepsy. Next. So how do we treat epilepsy? Because it definitely does need to be treated to prevent having further seizures. So the most common and first line that we go to for treatment of epilepsy are medications. If you just keep clicking, another way we can treat epilepsy is with surgery if we identify either a tumor or a lesion, or there could be multiple other reasons why you could have surgery for epilepsy. And then another way we can treat epilepsy is by using implantable devices with VNS, RNS, or DBS. And then the way we're going to focus on today is by using dietary therapies to treat epilepsy. Next. So why keto? So this graph is used a lot in presentations and kind of it just goes over the amount of medications that have been discovered and have come out to the market in the past 100 years. And if you can see at the very bottom, I highlighted around 1920 is when keto was officially used as a treatment for epilepsy. But despite all of these additional medications coming out to the market, we still have to frequently rely on keto to control seizures. Next. And we need to rely on keto because we know that 1/3 of those with epilepsy have uncontrolled seizures despite medication or surgery may not be an option for them for some type of resection. So it's important that, and it's a reason why keto is still very prevalent in the use of treating epilepsy today. Next. So the history of the keto diet. So not only have we been using it for the past 100 years formally, it even dates back to the time of Hippocrates, which is back in maybe like 400 BCE. So in his works, he described using fasting as a treatment for seizures. And the picture just says, let food be thy medicine and medicine be thy food, which I think is very applicable to the ketogenic diet. And then maybe fast forward 500 years or so, this is Raphael, the painter, his famous painting of the Transfiguration of Christ, which is the first known painting to have someone with epilepsy in it at the bottom right corner. In Mark, it is noted that they used fasting and prayer to treat seizures. And then in about 1921, Dr. Wilder of the Mayo Clinic said, what if we can trick the body into a fasting state, because obviously fasting is not sustainable. And he came up with the use of a high-fat diet to get our body into that similar state that we go into if we're fasting. And has been used since then to treat epilepsy. Next. And it has been proven time and time again to be a very effective treatment for epilepsy. So the Cochrane review that looks at multiple different studies and kind of gathers all that information and then puts it together for like a bigger cohort. There have been multiples of those that have come out. Seizure freedom rates are as high as 55%, which usually it's quoted maybe like 25% can go seizure free. The responder rate is close to 90% of people who try a ketogenic diet do have some response to it. And at least 40% have at least a 50% reduction in their seizures. And at least 15% of those become seizure free at 3 months. Next. So we wanted to plug in a few like Q&As in here as well. So one question was, what if keto doesn't help with a drug-resistant epilepsy? So if keto doesn't help, I think that you can always make some modifications if you either get a second opinion or talk with your dietitian about it. If all the modifications have been made, then I would talk to your neurologist about other surgical options, which include those implantable devices. Next.
Okay, so I'll go ahead and we'll just review a little bit about what exactly is the ketogenic diet. So the ketogenic diet is a very high fat diet with moderate protein consumption and a very low carb intake. So in general, for someone who is on the classical ketogenic diet, which we'll review further in detail in a few slides, you're limited to no more than 10 to 15 grams of total carbs per day. So this is very restrictive. Basically about 80 to 90% of your total calories are coming from fat. And when we say fat, we mean things like oil, we mean butter, and we mean mayo. Those are, and we do use heavy cream as well as a fat source. Those are our fat sources that we use for the ketogenic diet. The goal is to push the body into ketosis. So generally, on our typical American diet or in general, the body runs on carbohydrates or glucose for fuel. The goal is to deprive the body of carbs to start using fat as energy to produce those ketones that we see with the ketogenic diet. So you always see the ketogenic diet listed as a ratio. So what is the ratio? So it means the number of grams of fat to the number of grams of fat plus carbohydrate combined. So the ratios can vary from anywhere from a 1-to-1 to a 4-to-1. So 4-to-1 would be considered our most restrictive ratio. So which means, so for every 4 grams of fat in your diet, you are getting 1 gram of protein plus carb combined. Next slide, please. So what's a typical American diet versus a ketogenic diet? So typical American diet, typically our carbohydrate intake is anywhere from 55 to 60% of our total calories. Fat is about 30%. You know, sometimes some individuals follow a lower fat diet, so that could be around 25%, but that's your standard. Protein is usually typically around 15% of your total calories. If you hit next. And then so we transition that to a ketogenic diet. So what does that mean? So that means that 90% of your total calories are coming from fat. And then protein is also restricted. So about 7% of your total calories are coming from protein. And then basically only about 3% of your total calories are coming from carbohydrates. So basically it's drastically switched from carbohydrates to fat as your primary source of nutrition. Okay. Next slide, please. Okay, so these are like just the various compositions of various ketogenic diets. We'll go in more detail about the variations between the two, but in general, all the ketogenic diets, the fat intake is going to be greater than 60% of your total calories. Your carbohydrate intake is going to be severely restricted compared to the American diet. And then your protein intake in general, depending on which version of the diet you're going to be on, can be also restricted. The classical ketogenic diet is definitely our more restricted version of the diet. And then we have the modified ketogenic diet, low glycemic index treatment, and then MCT oil diet, which we'll review further in a few slides. Okay, next.
So we wanted to bring up some side effects that can happen with keto because it isn't a benign diet. It's not this au naturel type of diet for your epilepsy. You're really like making that metabolic switch into ketosis, which does come with these. And keto should always be under the supervision of a dietitian as well as your neurologist. So some things that we can see that can happen when our bodies are switching over to use ketones for fuel instead of the glucose. We can see low blood glucose. So sometimes people might get shaky when that happens. Acidosis is a really big side effect we can see with keto, which definitely leads to some of like the keto flu symptoms, which you may have heard of. There are ways to correct this, but basically ketones are an acid. So when our blood has too much acid in it, because it's going to have more ketone bodies, it does not like that. So sometimes you might have nausea or vomiting associated with the acidosis. You might be super tired, which kind of goes along with that keto flu. That usually we see resolve in about 1 to 2 weeks after starting. You may not feel hungry because the meals might look smaller, but you're actually still consuming a lot of calories in that smaller meal with all of the high, heavy fat. It's like eating a Thanksgiving dinner for every single meal. We can see, most of the time we see constipation, but things could go the other way with having diarrhea. Dehydration can happen if you're not keeping up with your fluids. And we can see weight loss, which is usually due to the loss of appetite. Next. Some long-term side effects we can see with keto. We can see elevated cholesterol levels, but we have seen more often than not that these usually elevate within the first 6 months, and then they usually start to lower and return back to around normal range. We can see elevated triglycerides, and for this, we might start some fish oil. In addition, for the elevated cholesterol, we would talk about reducing the saturated fat intake, so probably less bacon and more oils that are healthier oils, or healthier sources of fat. Osteopenia can happen because fat doesn't have a lot of our nutrients in it that we need that carbohydrates have. So for kids at CHOP, we get a baseline DEXA scan, which looks at their bone density. And then we repeat that every 2 years as needed to make sure that they have good bone health. Again, GI complications, constipation can be a chronic issue, and a lot of times we need to add Miralax to help with that. We sometimes see slow motility, which we depend on our GI friends to help us with adding erythromycin to help with speeding up the motility of the gut. Reflux is a big side effect because ketones are an acid. So we frequently have to add types of antacid type of medications. And I guess we wouldn't use Zantac anymore because it's off the market. So we use Pepcid instead now. And chronic gas and distension can be issues as well. And next. So again, we can see the chronic acidosis. So usually we have our kids on different types of citrates or sodium bicarbonates to help offset that, the acid in the blood. Kidney stones can be a side effect. We know that with high acid levels, sometimes urea kidney stones can form from being on the diet. Growth failure can happen. This is something that we monitor and sometimes refer for growth because we need insulin to grow, and we're not making as much insulin if we're not really making glucose or using our glucose as much. Vitamin deficiencies can happen, so this is why we do frequent monitoring every 3 months to make sure that we're supplementing appropriately. And pancreatitis can happen. This is why we are also frequently monitoring their triglycerides and their liver function tests. Next slide. So keto obviously has benefits to helping someone's epilepsy, but there are also many other benefits that can come along with a ketogenic diet. It can definitely improve sleep. It can improve alertness. We can see improvement in cognition. We usually see a positive change in behaviors for those who have behavioral difficulties. And then overall, we see an improvement of quality of life, especially if someone's having less seizures. That almost always leads to an increase in their quality of life. I know a lot of times we've seen kids just become like so much more brighter, like even when they're starting keto in the hospital. And sometimes we see that happen before the seizures get under control. And that's definitely rewarding to see. And next.
Okay, so I'll review a little bit about what exactly is the ketogenic diet and what does that mean. So in general, it requires an inpatient initiation, as Sarah mentioned previously, with all the complications that can occur with starting the diet, in risk of acidosis, low blood sugars, all our kids are at risk for that. So we need to monitor them closely. So that's why they are admitted. They're admitted usually for a full week. Our inpatient initiation typically goes from a Monday to a Thursday. All the foods are weighed on a gram scale to the 10th of a gram. So we have a scale recommendation for all our families that we encourage them to purchase. Every meal does have to be weighed. So even like, let's say when I said we can use heavy cream as a fat source, that's also being weighed on the side. Our carbs and protein are limited. Like I said, fat provides the majority of the calories, so the majority of the diet will be butter, oil, and mayonnaise. We do have options for families that are vegetarian, follow dietary restrictions, so we take all that into account when we see our families. Each meal plan is tailored specifically to each individual child. So we do ask our families to submit like a 3-day diet record prior to starting the diet. And we actually ask them to weigh all their food out on a gram scale to get practicing on how to do it. And from there is basically where we get a baseline calorie goal for our families. And then from there, we will determine the exact amount of protein and carbs that we need to restrict. The ratio is really dependent on how bad the seizures are, how old the child is, our discussion with the neurologist, and what is our goal of care. Typically, obviously, the 4-to-1 diet is seen to have the best efficacy. However, it is hard to tolerate as well. So sometimes with our older children, we will stop it at maybe a 3-to-1 ratio so they don't have to eat as much fat and maybe have a little bit more protein and a little bit more carbohydrates. But in general, the classic ketogenic diet is considered the most efficacious out of all the diets that I'm going to discuss. Okay, next. Okay. Another option for a ketogenic diet is the modified ketogenic diet. So I know if you've heard of like the modified Atkins diet, this is kind of a similar approach to that. This does not require an inpatient initiation. It can be done on an outpatient basis. We don't have families weigh on a gram scale. Everything is done in household measurements. So in comparison to the classic diet, we're only measuring net carbohydrates, meaning that you're able to subtract fiber from the total carbs. So let's say, for example, We have a piece of bread that's high in fiber. Each slice is 10 grams of carbs total, but you get 5 grams of fiber per slice. So they get to subtract that 5 grams of fiber, so only have to count 5 grams of net carbs for that bread of slice toward their total carb goal, whatever it may be for the day. Compared to the classic ketogenic diet, we do not subtract fiber. So the total carbohydrate goal includes fiber as well. Fat is encouraged, so we typically do give like a serving goal for how many fat servings we want you to have in a day. It's not nearly as high as compared to the classic diet. At least we usually typically start off with about 60% of the total calories as fat and adjust from there. Protein intake is definitely greater than on classic ketogenic diet. I want to say it's technically sort of unlimited. We technically don't give serving portions for the protein allotment. But however, if we notice that a family or a child is eating way too much protein for their needs, we'll ask them to cut back, because if we're eating too much proteins, it can definitely hinder ketosis, because the proteins will actually, if we're overeating, can actually convert to glucose to be used as a source of fuel. So we have to be vigilant in that as well. It definitely is a little bit easier. It's less regimented. Like I said, you don't have to go into the hospital. You don't have to weigh out foods. It's easier just to read food labels. You can pick up and go on the go a lot easier than you can say with on the classical keto diet, where you would have to technically probably bring your scale with you or make sure you have a meal prepared depending on where you're going. So this is typically something we probably do more so for our teenagers. It's definitely more doable for them, especially our teenagers that are going to school, playing sports, and things like that. Okay, next slide, please. Okay, so what is the low glycemic index treatment? So it is definitely a much more liberalized compared to the previous two that I just talked about. Our carbs are still limited. Protein is definitely more liberalized. It's not limited in any means. And of course, fat is still encouraged. So basically what this means is that we ask families to choose carbohydrates that have a glycemic index of less than 50. So what does that mean? So basically, glycemic index means like how much a food raises your blood glucose compared to how much pure glucose raises blood glucose. So basically, carbohydrates with more fiber will not raise your blood sugar as quickly as compared to, say, food like white rice, which does not have any fiber in it. So we provide families with a list of carbohydrates that have less than with their goal of less than 50. So this is supposedly supposed to help with seizures as well. We don't tend to use this too often here at CHOP. We do encourage using low glycemic index carbohydrates, but we don't base our approach just on this alone. Some of the foods that that would be used with low glycemic index would be like green vegetables, grapefruit, avocado, lentils, quinoa, and things like that. That was it. Okay, next. Okay, what is the MCT oil diet? Again, still another liberalized version of a ketogenic diet. So basically, the goal is to introduce medium chain triglycerides into the diet because they can produce ketones easier than long chain triglycerides, so less fat is needed. This is done because MCT oil can bypass the liver and go straight to be used as energy. This version does allow more carbohydrates and protein to be included in the regimen. So the MCT oil still has to be split between meals and snacks. We still do give a fat goal. 100% of the fat is not going to be coming from MCT oil though. So typically it's about 50% of whatever your total fat intake is recommended for you. And that's because MCT oil does also have GI side effects. Taking large doses can inhibit diarrhea, GI discomfort and pain. So, this is something that's done in a stepwise process. We don't use this diet alone here at CHOP, but we do incorporate MCT oil into our classic diet for our keto kids who are trying to like boost their ketones or something like that. But we also are very mindful of how much we're introducing to try and prevent any of the GI side effects. Okay, next slide, please. Okay, so what exactly is the ketogenic diet for weight loss? I mean, so there's like, if you Google ketogenic diet for weight loss, honestly, there's so many versions that exist for weight loss. So basically in general, like per the popular sources, like basically on average, 70–80% of your total daily calories are going to be coming from fat, which is similar to what our standard practice is too. 5 to 10% of carbohydrates, or 5 to 10% of your total calories coming from carbohydrates, and then 10 to 20% of your total calories are coming from protein. So for an example, I just put here, if you were on like an 1800 calorie diet, you would have 145 grams of fat, 45 grams of carbs, and 90 grams of protein. So the 45 grams of carbs, though, it's pretty liberal for someone on a true classic keto diet. Typically for our kids, that would be way too high. So even when we do our modified diets for our kids, the range, usually we're at like 10 to 25 grams net carbs per day. So anything above 50, unfortunately, we tend to see, like even 45 might be a touch high. Above 50, we don't really see ketones being produced because the body's still getting too many carbs for that to occur. So basically it talks about restricting carb-like foods for like whole grains like breads, pastas, corn, starchy vegetables, fruit, juices, beans, legumes, I mean most fruits. We do not encourage any type of restriction whatsoever. We do encourage our families obviously to incorporate any type of fruit, any type of vegetable they can. We do encourage obviously them to choose options that give more volume. So let's say if you're on a severely carb restricted diet, you would get more strawberries per 1 gram of carb compared to what you would get for a slice of bread. So, but we do have, we work with a lot of kids, this is a hard diet for them. So we allow what they wish to be their carb source. If we have kids that love just eating goldfish as their carb source, they get maybe like, if you've seen those mini goldfish, like maybe like 5 or 10 of those, and they're happy, and that'll be their carb for a meal, and they would be happy with that. The ketogenic diet for weight loss, they say they allow foods high in saturated fat, such as fatty cuts of meat, processed meats, lards, butter, as well as sources of unsaturated fats, such as like nuts, seeds, avocados, plant oils, and oily fish. And in general, when it's talked about the ketogenic diet for weight loss, like all these are technically considered fat sources. So you would think, oh, you always hear, oh, avocado is a great fat source. So technically though, for our kids, avocado is considered a carbohydrate. Yes, it does have a lot of fat, and they will be able to subtract some of their fat from their total fat allowance, but avocado is considered a carb, so it wouldn't have to be restricted. So, I mean, just some variations, encouraging like bacon as a snack and things like that. We don't encourage either. We do our best to encourage healthy sources of fat, healthy sources of protein within reason, keeping in mind, the family's normal eating habits, cultural preferences, and things like that. Next slide, please. Okay, so what exactly is it like to be on the classic keto diet? So basically, families are weighing all their food, their child's food or a meal plan to the 10th of a gram on a food scale. And this has to be done for each meal, each snack of the day. I mean, because of this, we do talk to our families. We encourage batch cooking. We encourage having meals prepped and ready to go for the week so that you don't have to always break out your scale at each meal to weigh something out. We do have families that don't mind doing this, but for some families, this can be quite cumbersome, especially if they have other children or a lot going on in their lives. I mean, unfortunately, you have to, like I said, pack your scale wherever you go, or bring pre-measured food. I mean, it's doable for sure. We have plenty of families that go to Disney World. We have families that travel abroad. We have families that go, you know, on vacations all the time. It just unfortunately takes a lot more planning, but it definitely can be done. They have to drink heavy cream, eat butter, mayo, or oil with each meal, you know, and this can be hard too for kids. Like, so here at CHOP, we're very fortunate. We do have a medical chef educator. She's actually created quite an extensive list of various ketogenic meals that are somewhat similar to what you might see for like a child that likes like chicken nuggets or something like that. We have a chicken nugget recipe that's keto friendly. We have a mac and cheese recipe that's keto friendly. We have a pizza recipe that's keto friendly. Is it exactly the same? No, but it's very palatable and it helps hide all this extra fat that we are having them have to eat. So like Sarah said before, we monitor vitamin and minerals every 3 months because of the fact the ketogenic diet is so high in fat that they are not getting a large amount of vitamins and minerals. Most of our vitamins and minerals comes from our carbohydrate and protein sources. So all our kids are supplemented 100% of all their vitamins and mineral needs. Typically involves multivitamin and several other like a magnesium, selenium, like it's just variable per child depending on what supplement plan they want. But either way, all our kids are supplemented. Even our modified kids there whose diet is a little bit less restricted, we still supplement and we still monitor labs every 3 or so months to make sure that we're not having anyone become deficient. It can be easily done. Even kids who are tube fed, we've seen have a vitamin and mineral deficiencies. So we're really vigilant about making sure that all our kids are meeting their needs. We encourage monitoring the daily fluid intake. So like Sarah said before, like, you know, one of the risk factors is constipation. So, and added that to not drinking enough fluid can make it far worse. So we always give all our families a minimum goal of what we would like them to reach in a day to make sure that they're trying to stay hydrated, encouraging like proper bowel movements and things like that. And like I said, like we have them monitor bowel movements because like of the fact that constipation can be an issue, to see if we need to intervene with any other medications, because, you know, we've had families too at the same time, like, you know, go a whole week without having a bowel movement, and that's not okay. And, you know, when that happens, kids tend to feel really sick, uncomfortable, they don't want to eat. Which can cause like other issues. So could also cause increase in seizures from the stress on the body. So, you know, it's like this whole approach that we need to take with each child to make sure they're doing well in the diet. We have our families check finger sticks. So they have to prick themselves weekly to check out blood glucose and ketones. We have them monitor this to make sure their blood glucoses are stable and that they're actually having ketones. This also helps guide us a little bit depending on whether we need to adjust calories, if we need to adjust ratio, maybe we want to add in some MCT oil to see if we can boost the ketones, if that's helpful at all. We have families check, they do urine dips for pH, blood, and ketones weekly as well. And then let's see. And then of course, prior to starting the diet, we make sure to review all their medications because unfortunately most liquid medications have a large amount of carbohydrates you wouldn't think of, but it does contribute a substantial amount for someone on the keto diet and actually can bump them out of ketosis. So a lot of the times we have to switch our families over to tablets or capsules, depending on what they're currently on. And of course, it's like, you know, holidays and parties definitely can be a challenge. You know, you're surrounded by food and, you know, our families are limited to what they can offer. You know, you have a kid, if you have a developmentally appropriate child and you go to a holiday party, you know, they might want, you know, just a cookie because their brother and sister is having a cookie. So it can be difficult, but we always encourage our families, you know, to reach out ahead of time to the family, or if it's a birthday party or a holiday party, to see what they're having. Then so that family can make something similar that would be keto friendly and bring it along for their child. You know, do things that are not food motivated, but like things like activity motivated for kids can be helpful as well. Okay, and next. Okay, and then I just want to give an example of what an actual 4-to-1 ratio meal would look like for one of our kids, possibly. This is just based on 450 calories. This would be the most restrictive diet we would put you on if you were an oral eater. So your fat sources would be the heavy cream and then the mayo and butter. So you see the heavy cream, the 2 ounces on the side. Sometimes a lot of families like to dilute this, and this can be their milk for their child. 22 grams of butter or mayo, which you see next to the eggs and the bacon, which is about approximately 1.5 tablespoons of butter. And then their protein would be the scrambled eggs and the bacon. And then applesauce, so would be their carb source. And you can see that for this plan, about 1 tablespoon of applesauce would be the allotment they would get per meal. Now, this is actually a pretty large meal for a child, you know. So think about, in general, most of our kids, the younger ones especially, are probably maybe like half of this. So it's much smaller too as well. So you can see the difference in portion sizes compared to like what a normal diet would look like. I mean, in general, 450 calories, you probably would have a couple strips of bacon, like maybe 1 or 2 eggs. You probably wouldn't have any butter on the side, and you would have maybe at least a whole container of applesauce, like 4 ounces. So it is not an easy diet for sure, but we do our best to work with our families to make it the most palatable for our kids, especially just knowing that this is their next hope to try and help reduce their seizures. Next. Okay, so there was a question, I think, on the community service about like estimated costs of starting keto. So we kind of did something similar like a while back to see how much it does cost. I mean, and in general, unfortunately, it can be pricey to start off. So, you know, a lot of times the scale, we recommend several like miniature spatulas, lightweight bowls for cooking because they're easy to weigh on the gram scale, because those gram scales only weigh up to like 220 grams. So you need something light to weigh out food. We use a lot of mayo. We use a lot of almond flour. Obviously, a lot of butter, canola oil. So, you know, since carbs are limited, we have some options for sweeteners for our kids that we like: the Da Vinci sugar-free syrup, the Walden's Farm syrup. So we estimated getting all the basics of what we would typically recommend for a family starting out in keto. And we came around like an average like of $140. So like, obviously, this can be quite cumbersome for some of our families. So, you know, we work with our families, we work with our social worker, you know, we do our best to to get them everything they need within their means. Next.
All right, so I wanted to go through some myths about the keto diet. So this is also one of the questions that came through on the community survey, saying that it doesn't work for certain epilepsy types, which is a misconception that people have, but keto can actually work for all different types of epilepsies. It does seem to work extremely well for certain types, but it can work for any type of epilepsy. It seems to work really well in kids who have myoclonic atonic epilepsy or DOSA syndrome. It is like almost definitely recommended that someone with a GLUT1 deficiency or the pyruvate dehydrogenase deficiency be on a ketogenic diet, because they have trouble in their pathways with metabolizing glucose. So it works excellent for those. It can work really good for those who have tuberous sclerosis. It can work really well for those who have Angelman syndrome or infantile spasms, which are just to name a few of the epilepsies that can really help. Next slide. So I can't do the keto diet since I'm vegetarian. You can absolutely do the keto diet with a vegetarian diet. It would just involve no bacon, but there's different protein sources that are definitely vegetarian friendly, and You can even, vegan might be a little bit hard, but it probably could be done with just more oils. There's even a lot of like veganase to replace the mayonnaise option, a lot of different options that are out there. And then I hear a lot of times people thinking that their child will lose weight if they start a keto diet, and they will not, because we have Sarah and our two other dietitians who will make sure that they are maintaining their calorie needs and continuing to look at their growth and adding calories as needed as they continue to grow. Next. So these were some of the community survey questions that had come in. If you can hit next one more time. Oh, okay. So the first one, how do seizures hold up with less carbs and sugars? Someone had said that there's increased when they lower carbs and sugars. I think that for this, you would really need to get into ketosis to be able to see anything. I think if you're just kind of limiting carbs and sugars and putting that stress on your body, would maybe not necessarily adding fat or sticking with it for at least a few weeks, that could be why you're having an increase in your seizures. We ask all of our families to give us 3 months on the ketogenic diet before kind of saying that this isn't really working, because we know that by the 3-month mark, 90% of people who are going to respond to the keto diet will have a response by then. We usually say for modified keto to give us 6 months of trying it, because we do see that it can take a little bit longer to kind of get those ketones built up. The next question, how can I be successful with this diet without interfering with a healthy gut function due to all the changes? So there are a lot of changes. I think if you wanted to be super mindful about those changes, you could possibly do it slower, like a slower initiation, or do the modified diet. You could also take a probiotic to help with it as well, but it does interfere with the gut a good amount. And there's right now, actually, though, a lot of research being done into like the gut brain health area of how the keto diet works. But it's definitely something you have to consider when considering a keto diet as an option. And next.
Okay, and it says, is keto easier for kids? So not necessarily. I mean, it can be in the sense that, you know, you have parents that are taking care of your every need, making all your meals and things like that. But it's definitely not easy for some kids, especially kids who are very well aware of what's going on, who have siblings and they notice the difference in change in the diet. So it can be variable. We have some kids that do great. You know, we have all these options for different recipes that they love, they enjoy, they're totally okay with it. We have kids that absolutely hate it and are just upset and not happy with the change. And, you know, and it could definitely does interfere with their eating. We've had kids refuse to eat. And, you know, there's other things going on too that compound all that. But I would not say it's easier for kids, and for our older teenagers who we start on the diet, it's definitely much harder for them, especially socially. If they're around their friends, they want to go out to eat. So it's not an easy diet by any means. It's definitely easier for our children who unfortunately are, you know, development delayed, you know, or tube fed, then of course it is easier a little bit for them. But you know, any of our neurotypical kids, it can be hard for them. But you know, we work with each family and we do our best to, you know, to help them to get through this.
Also, to kind of add to that real quick, we also have epilepsy psychologists who can help with some of the feeding difficulties at CHOP, which I think more epilepsy centers are probably starting to have that incorporated, but not necessarily. And then we were going to give out some links too, but we wanted to note that a lot of the meals can look very tasty and not really kind of like the piecemeal, but it was just kind of to show you what are the pieces of the meal that can then make up a recipe, but some of them are really delicious as well. But and we have a whole bunch of different pictures you can look at on our website.
Next. Okay.
And then if anyone has any questions, you can type them into the chat and Rena can read those off for us.
Thank you both. Yes, if anyone has any questions, just put them in chat and I will read them out loud. So far, no questions. I have a question for you guys. Can you add spices into your meals or even like mix it up with the oils just to make it like more flavorful?
Absolutely. You know, we encourage the use. There's actually so much talked about. This is also part of the reason we do like a week-long initiation, because so much education goes into it. But yes, spices are definitely used. We encourage using of garlic, salt, pepper, definitely salt, cumin, you know, any type of spice that you can normally cook with, you typically can use. The only ones that we don't recommend using are the ones that have added carbohydrates to them, like sugar. And usually a lot of times it's something like, you know, like if you think of a taco seasoning packet, sometimes they have extra carbs added to them, but you can make your own taco seasoning out of cumin, chili powder, chili flakes and things like that.
Thank you. I think I fixed the chat, so everyone should be able to ask questions now. I have a question while we're waiting. You know, how long can someone be on the ketogenic diet for? Is there like a certain amount of time before they have to maybe do a different diet?
Well, it depends. I mean, most of our oral eaters, you know, typically at least like 2 to 3 years, we encourage, and from there, depending on what's going on, we can determine if we need to wean the ratio, or we can start weaning the ratio or not. We do have had kids that have been on the diet 10, 20 years at this point. But keep in mind that those kids are, you know, or I guess technically some of them are adults now, are 100% tube fed. So it is easier to maintain. Although we do, over time, with all the side effects that Sarah had talked about earlier, we do try to work on weaning them off the diet at that point in time.
Thank you. All right, we have some questions coming in. All right, so what happens if someone breaks the diet for a few days? How should you get back into the diet?
So it would be like missing your medication for a few days if you were to do this and using it for epilepsy. So if it was just a few days, you would go right back to where you started. We tell our keto families that if maybe grandma or grandpa accidentally gives someone even just like a little pinch of extra carbohydrate, we tell them to give an amount of fat to kind of counteract the additional carbohydrate they got, because some people are that sensitive that if they have a little bit of extra sugar, it could provoke a seizure. Not for everyone, but we don't know who those people are going to be. So we always tell families to be aware of that. But if you missed it for a few days, I would just start right back on to where you left off.
Yeah, and just to add to Sarah too, like we've had kids, like, you know, it can be hard. So we've had kids like cheat like several times, you know, eat like, I don't know, find a cookie at school or something like that. And, you know, maybe the first few times nothing happens, but maybe that fourth or fifth time, that's when like something happens and then you can see a really severe increase in their seizures. So we always tell families, like, you know, it's really important to talk to your child about this as well. So like Sarah said, it's like missing a medication.
All right, great, thank you. So you mentioned beans. Are there any type of beans in particular that you should or should not avoid?
In regards to the keto diet, no, I mean, you can decide on whichever bean you prefer for taste-wise. There's no recommendation for which one to avoid or which one to encourage.
Okay, great. And does the ketogenic diet completely substitute medications?
Frequently, it is always started as an additional therapy. If someone becomes seizure-free and they're seizure-free for 3 months on keto, we will consider starting to wean off some of their medications. And some people do become seizure-free just on keto alone, and then can actually wean off of keto and remain seizure-free.
Okay. Do you need a dietitian supervision to stop the diet, and do you need to stop it slowly?
So do you mean if you're like already on the classic ketogenic diet and your goal is to come off? I mean, typically, yes. So when we wean our patients off the diet, we usually do it in a stepwise fashion. And this is also how quickly we wean is really dependent on how well they did with the diet. So like, let's say if like us in 3 months, we notice that the diet has like done nothing and has not helped the families, we can wean quicker with knowing that the diet probably was having little effect for the kid. However, if the diet brought about like seizure freedom or improved alertness, things like that, we will wean much slower. Because if we went too quickly, it's also possible that we would notice an increase in seizures and we would have to step increase it back up. We've had children who, if we started to wean the diet, and unfortunately at a certain ratio, their seizures worsened quite substantially and we had to go back up on the ratio. And I think I missed the second, I'm sorry, what was the second part of the question?
And if it needs to be done slowly.
Oh, okay, so yeah, so as I said previously to that, yeah, so it's variable, but typically in general, we wean most of our kids rather slowly off the diet, unless it's not working for sure, and then we can wean quicker.
Okay, great, thank you. When determining the ratio and considering how bad their seizures are, does this include all types of seizures?
Yes. I think it really depends. I mean, we usually tell families to say like, what is list, well, we make everyone do seizure counts before they start keto because it's the only way we're going to know if it's helping or not. And we say list as your first seizure type is the seizure you want to see first go away. So a lot of times those are seizures that are either making them have use multiple uses of rescue medication or going to the emergency room frequently, or seizures that are causing injuries, or like any type of severe harm, like while they're having the seizure. Those are definitely considerations when we think of like what ratio we need to use for someone's seizures, and the frequency, I guess, they're having them too.
Awesome, thank you. All right, a lot of questions here. Let's see. The next one is, can you explain a little bit more about like the physical effects that are happening that makes ketogenic diet effective in seizure management? Like what's going on in the brain when you're in ketosis to help?
So there's a lot of different pathways that it is thought to work on. And really kind of the simplified version is that ketones provide more fuel to the brain than glucose does. So with that, it's thought to be neuroprotective from having future seizures with being in ketosis. That's the simplified version. There's a lot of different areas that are being looked into right now.
Okay, great. All right, this question says, moving to the next ratio of keto, do you suggest very slow movement to the next level to avoid potential keto flu symptoms?
So in general, it depends what's going on, but like for the classic diet, why all our kids are admitted during that week is because we do rapid initiation. So we're starting them off maybe at like a 2 to 1, and we're increasing them, we're bumping them up to like a half a ratio to a ratio every day. So we do it rather quickly. Unfortunately, some of our kids do, feel the effects of getting used to using ketone bodies as energy, so that you have that flu-like feeling, which should resolve within a few weeks. But yeah, that's why they're all admitted to monitor for all those side effects. when we ramp up so quickly. We can do a much slower initiation. So let's say if we, for some reason, I don't know, we've had families that for some reason can't admit for the classic diet. We can do it in a much slower process. So basically we're probably upping a ratio every half week, but unfortunately it does come with more things that need to be done. So we also have our families go and get blood work done every week to make sure that their labs look good and they're not acidotic and things like that.
Okay, wonderful. I think we're caught up with the questions. We have a few more minutes, so if anyone else has questions, please put them in the chat. Okay, here's another one. How do you determine the top ratio of the diet?
Probably what's most tolerated. 4-to-1 is pretty much the highest we will go. In extreme rare cases, we might go a little bit higher for a short period of time to see if we can boost the efficacy of the diet, but that's never a long-term option.
Okay, thank you. I don't see any other questions. Okay. How long before anti-epileptic medications are withdrawn if keto is controlling seizures?
So specifically at CHOP, we wait at least 3 months if they're seizure-free at that point. If we're getting some results, we might maybe take away a medication that we don't really think has been working. But again, it's at the neurologist's discretion of when to do that.
Okay, thank you. All right. Well, thank you both so much. That was a very informative webinar. I hope everyone enjoyed that. I will be sending out an email with a recording, the link to the recording and some key takeaways on a PDF. So stay tuned for that. Again, both Sarahs, you did an amazing job, and thank you so much for being part of our webinar today.
Thanks for having us.
Yeah.
Have a great night, everyone. Thank you.
Thank you.
Bye-bye.
Bye-bye.